Good evening, everyone. Thanks for joining me tonight for the webinar entitled, I Am Home, Is It For Me? My name is April Christopherson. I am an occupational therapist. I have been using interactive metronome for the better part of 3 years and have transitioned into the I Am Home with many of my clients coming into this fall. It's a great new product, and I hope that you'll be as excited as I am when we're done with this presentation this evening. Just a few little points for you. If you have a question during the webinar, if you would please type it in the chat box, we will answer those questions at the end of the webinar. What I prefer you do, however, is wait until the webinar is completed before you type your questions in. And it's likely that throughout the webinar I will be able to answer your questions for you. So if you hang tight, and at the end we will have a question and answer session for you. I will be on the line, and we will have the Education Department from Interactive Metronome. Bricole Renke from Interactive Metronome Home will also be on the line. So we'll get you taken care of at that time. Again, I want to welcome you to the I Am Home, Is It For Me webinar. Interactive Metronome is suitable for a variety of diagnoses for both pediatrics and adults. And we will be talking through this evening as we go through. But as you see on the first slide here, there are several diagnoses that we've listed. Sensory processing disorder, Asperger's, autism, ADHD, cerebral palsy, dyslexia, stuttering, nonverbal learning disability, and others such as auditory processing disorder for both pediatrics and adults. As we move into the adult realm, what we see more often is the stroke, brain injury, Parkinson's, amputee, Huntington's, multiple sclerosis, spinal cord injury, balance disorders, functional decline, dementia, and low endurance and stamina. Now, don't forget that several of the pediatric disorders can also be applied to the adult population. It's just that we tend to see these diagnoses more in the pediatric realm. I'm going to discuss the concept of I Am, just in case you're not familiar with it. Interactive metronome is an assessment and treatment tool used in the therapy realm to improve the neurological processes of motor planning, sequencing, and processing. All of the videos that you will see in this presentation are on IM's YouTube channel, iMetronome.
So I first heard about interactive metronome. Our son was seeing a doctor that treats using the Defeat Autism Now protocol, and there was a little something in her office they were using. They had a practitioner that they were recommending. But after my friend started getting this treatment for her son and seeing great gains, I started looking into it. When he was 2.5, he was diagnosed with Asperger's syndrome. We went for a second opinion and got PDD NOS at that time. And since he was so young, the doctor who saw him felt that was a more appropriate diagnosis. And but we haven't had him reevaluated since that time. His fine motor coordination was a problem too sometimes, fumbling with things. More so with handwriting, I think. I homeschool, so in trying to talk about math or anything, explain anything, I was running into problems. Real difficulty reading some simple words that I thought he would be familiar enough with. He was missing words like, mixing up words like this with is or at with that. Sometimes reversing words made me wonder if he might be dyslexic. Just doing it was kind of fun for him in the beginning, and he was really motivated by what he saw on the screen, wanting to get those greens, really proud of himself when he saw the numbers improvement in his handwriting. It was much more neat, the letters were more evenly spaced and evenly sized. All of a sudden, he turned the corner on his reading and started reading chapter books by himself. And that has been a real pleasure for a family of bookworms to see him with his nose in a book and he's really proud of himself.
Cam Jansen and the Scary Snake Mystery. Chapter 1. Coming through, a man pushing a long rack of clothing called out. Mrs. Jansen took her daughter Cam's hand and pulled her out of the man's way.
He did a fantastic job of training with Interactive Metronome Home, and we're going to go into a little bit about what happened with Jesse in the brain. So brain timing is so important in anything you do. It's important because it determines how well you do an activity or how quickly you process something. Correct, repetitive task completion is important for learned skills and functional behavior. So as an example, if you have a baby who is learning to crawl, that baby will practice crawling hundreds of times a day until they have mastered the skill, if they're able functionally to crawl. So we're talking about a normally developing infant. That's repetitive task completion. Until they've mastered the task, that has created now a pathway in the brain that is correct and that will now process quicker to move on to the next skill level. So we're going to be talking a little bit about brain timing and why it's important for every day. It's important in its own right. It is important because it's a key factor in sports, music, and dance, in speech, and general life functioning. So the timing of my words right now, the pauses between my sentences, that is all timing of the brain. So my brain is telling my tongue and my mouth to pause or to speak at certain points, at certain times. That is everyday timing. Movement educators have also detected signs of a relationship between improvements in a child's timing and improvements in their reading. Think back to what you saw with Jesse on the video. He was not reading very well at all. It was very discombobulated reading. He would read one word and then process it and go on to the next word before he started the I Am Home. 6 months after that, you just witnessed Jesse reading a chapter book to you. I think that is so powerful because that is a very short period of time. When that child had been working on reading skills for the 5 years before that and had not mastered those reading skills, we have an idea that that comes back to the timing system in the brain. We have many timing systems, and we are not going to go into that today. Just for simplicity's sake, if you have a desire to learn more about timing, there is all kinds of research on the website from Interactive Metronome. But just for today, we're going to talk about 3 different timing systems that we do have. Each timing system is related to different behaviors, and each timing system is also related to different areas of the brain. We've highlighted some areas of the brain here, and obviously there's a whole lot more of the brain than what we've showed you here. Interval timing is one of the timing systems. It's the fastest timing system. It plays a role in speech and language, music, motor behaviors, attention, cognition, and other areas. But those are the main areas that it plays a role in. What you see on the right is a brain that has undergone an MRI. And what this MRI shows is what areas of the brain actually light up when a person is doing interactive metronome. What we found from this study is that the cingulate gyrus lights up. That allows shifting of attention and focus, and it also allows cognitive flexibility. So if you know someone who is very inflexible, always a rule follower, always legalistic that way, that may have something to do with the cingulate gyrus. The basal ganglia also lights up when you do IM. That integrates thought and movement. So think about walking, chewing gum, and thinking about what you're going to cook for dinner. Some of us have a really hard time with that. I'll admit that I do. There are certain days I have a hard time with that. So we have to bring that into focus, that the basal ganglia is the part of the brain that controls that. The last part of the brain that lights up is the medial brainstem. That's your neuromotor pipeline. That's where your brain gets all the information that tells you move your arm or pull your hand back, that's hot. That's your neuromotor pipeline. Interactive metronome has been shown to help interval timing. Interval timing plays a key role in understanding and diagnosing developmental delays. So when your child or yourself has gone in to see a specialist to find out what's really going on developmentally, oftentimes what they'll do is they will look at the timing. How does your body move? Are you able to balance? Does your right and your left sides work together? Do you have a hard time with motor planning and sequencing? That, again, comes back to the interval timing, and we know that that is so important with developmental delays. After we've got a diagnosis, it also helps, the interval timing helps with creating effective treatment in the classroom and the clinic setting. So the IM is going to help the brain use better interval timing for task completion on an academic level, a daily life skill level, and a social level. This video explains the concept of timing.
Hi, thanks for joining me. Today we're going to talk about brain processing and just how it works. We've had a lot of questions about what the concept of brain processing is and how it can differ so greatly between people, especially children. So let me use an example today with computers. Our brains are essentially little computers that run and they send signals and they give information, not unlike getting on the internet and asking your computer to drag up information that you want to research. Your brain is similar to a computer. I have two computers here. Let's imagine that this computer runs on DSL or wireless internet. It's very, very efficient, doesn't have a lot of processing problems, and you usually get your information within seconds. It's hard to believe that a few years ago we all used to be on dial-up, like this computer. Dial-up is shared internet connection over a phone line. Wasn't very efficient, and you didn't get your information in a timely manner compared to the DSL that we have today. Now let's imagine that I'm the teacher of a class and you're within my classroom. You're one of my students. My processing speed is on DSL. Therefore, all the information that I give you in the classroom is very fast and it's very efficient. When I'm giving you sequences of information, I'm expecting you to grasp that information either auditorily, visually, or graphically. Write it down, retain that information. Now let's imagine that your brain is working on the dial-up concept. So you're moving along just fine, but then you come to a glitch and you need to process or buffer that information that I've given you just a little bit longer. By the time you've gotten that concept down, I've already moved on to the next chapter and you've missed out on a great deal of information. A lot of us have learned to compensate when we have that dial-up model of processing. We nod our heads or we say yes, just so that we're not embarrassed in front of a group. But if your child is having processing difficulties in school, some of the things that you might notice are behavioral outbursts, or a strong dislike of the teacher or the classroom, or just plain giving up and saying, I hate school, I can't do it. Well, if we help them get their processing back to the level of DSL, it's much less frustrating. Interactive metronome is a technique and a treatment that helps the processing in the brain become more efficient and quick. It helps with working memory, helps with sequencing, it helps with our long-term memory, and it helps with a lot of different motor planning and coordination aspects. If your child is struggling in the area of processing difficulties, or if you yourself have had issues with processing and you know that you should be grasping information and processing quicker, feel free to contact us at Interactive Metronome or imhome.org. We'd love to talk to you about this and help you with your brain processing. Thanks so much.
That's what I was talking about with interval timing. So interval timing is what helps you process quicker, understand information coming in, and then relay that information to the correct area of the brain. So let's talk in simple terms now. That might have been too heavy for some of you. So let's talk about a lawnmower. I want you to imagine a meadow of grass growing with no boundaries. No boundaries, just a big, overgrown meadow of grass on a wonderful sunny day. Now imagine that someone or yourself mowed a path through the middle of the meadow. You'd have a nice walking path. But imagine that the meadow grows back again, and by the end of the summer, there's now no sign of a path. If you mow it one time, you're not going to have a path. But let's also imagine that someone keeps mowing that meadow. They just mow a new or a different path each week in zigzags. At the end of the summer, would you have a path to walk on that would be clearly defined? Probably not. You might have a little bit of overlap, but you're not going to have a clear path through that meadow. If you mow the same path every week for the entire summer, you will see an obvious path to take through the meadow, even if the rest of the grass around it is overgrown. This is a simple explanation of creating new pathways in your brain. Continued repetitive use of the same pathway creates better, faster processing. Neuroplasticity, and I'm just going to give this to you in very simple terms, is a term that describes the capacity of the brain to change and adapt, or to be plastic, to be movable. The changes occur in response to stimuli. That could be cognitive demands and new learning, or it could be sounds or vision. It's stimuli that your brain has to interpret. And that results in the brain creating new neural pathways and connections to deal with that new information. So that's what neuroplasticity is. I want to show you this diagram, not to overwhelm you, which is pretty much the first thought when most people see this. This is the brain telling the hand to pick up a coffee cup. And as you can see by this diagram, there are 8 steps, 8 areas that the brain is constantly working on just to get your hand to reach out for that coffee cup. Not overreach and not underreach, but absolutely reach right to the right spot that it needs to be. That is what's going on in your brain in millisecond timing. And if your brain is not timed correctly, you will overreach or you will underreach for that coffee cup. So again, the importance of timing. Research does support the use of interactive metronome as a valid treatment tool for many diagnoses, and there are over 10 years of product-specific research. Interactive metronome does not support or sponsor that research monetarily. I want you to understand that that's outside research. And we also have more neuromotor research than any other brain fitness product on the market today. In summary, IM shows statistically significant improvements in attention and concentration, motor coordination, language processing, reading and math fluency, and the ability to control impulsivity and aggression. If you would like to read more about research, I would encourage you to go to the website, interactivemetronome.com. All of the individual research papers have been wonderfully arranged, and they're organized on the website. I would encourage you to go there and read about the research if you have further questions. We're going to talk a little bit about the success stories now with interactive metronome. TJ is a 7-year-old boy with ADHD. That was his diagnosis. He was on medication, Ritalin, for behavior problems, but those problems were still present. His parents and teachers reported that his difficulties were most in the area of sustaining attention, sitting still, completing tasks, and activities with new motor challenges. Now, if you're like me and you look around the schools today, that's probably a lot of 7-year-olds that you see in the classroom today. But we know that TJ was still acting that way after he had Ritalin every day. So we've got a pretty big problem here. TJ did training with Interactive Metronome for 18 sessions, and at the end of those 18 sessions, the reports from his parents and teachers were that he had improved motor coordination, improved social skills in school and play, increased self-confidence, improved organization and initiation, and improved core strength and balance. Those are pretty good results in a short period of training time. The next case study that I'd like to talk to you about is Anna. Anna is 12 years old, and she had a diagnosis of pervasive developmental disorder, non-specified. That's also in the range of Asperger's or autism as well. She had sensory motor dysfunction as well, which a lot of the children who have the Asperger's autism PDD diagnosis also have sensory integration or sensory processing dysfunction as well. Anna had been receiving speech and occupational therapy since she was 5 years old. She was homeschooled by her parents, which was really great for her in home programming. She suffered from these areas, which is why she was exploring Interactive Metronome Home as a treatment tool. She was suffering from receptive and expressive language deficits, auditory hypersensitivity, abnormal voice prosody, motor planning deficits, poor limb coordination, impulsivity, distractibility, tactile defensiveness, and anxiety. That's a pretty big list for a child who's 12 years old going into adolescent years. That's a pretty big list. Following 25 sessions of the Interactive Metronome treatment, these are the things that Anna had improved in: increased attention, improved coordination and concentration. She was more talkative and more engaged. Conversation skills improved. Balance and coordination improved. She had a decreased tactile defensiveness, and again, that goes to that sensory processing area. Improved overall processing, probably from an auditory and a visual standpoint, and improved sleeping patterns. Her parents also reported that her voice was no longer monotone, and she improved her prosody of speech, resulting in a more natural sounding voice. I want to introduce Kelly to you. Kelly Buggle was a 17-year-old high school senior who had an unfortunate motor vehicle accident when she was a senior. Some of the things about Kelly, after the accident, she had multiple body fractures. So not only did they find out later that she had a traumatic brain injury, but she had functional disabilities that still affect her today. Compression back fractures. Her arms were both fractured. She had paralysis of her right leg. And as I said just a minute ago, her TBI went undiagnosed at first, so they didn't even realize that she had problems with her brain functioning. They realized that Kelly had problems with her brain functioning when she couldn't do simple math. This was a girl who was at the top of her senior class for algebra, and she was the top of her class for that, and now she could hardly do simple addition. She also could not identify common objects, such as a microwave. She couldn't think of the words, so she was having word finding problems. And she couldn't complete standardized tests or testing in the high school, so she actually had to drop out her senior year and school at home for the rest of the year while she was in rehabilitation because she couldn't handle the testing. Kelly began the Interactive Metronome in April of that year, and by August she was ready to go to school, college, community college. These are pictures of the accident that Kelly was unfortunately in at the time. As you can see, this was a very severe accident. Again, that's a picture of Kelly, and I just appreciate her sharing this with us. I know that that's very difficult to do. After 4 months of starting therapy, as I said, she was ready to go to college. She went to the community college in her area, and she got a 4.0 GPA for the very first time in her life. So not only before the Interactive Metronome and before the accident was she a good student, but after the accident and after the Interactive Metronome treatment, she actually improved her academic support or her success. Kelly is now in a pre-med program at Florida State University, majoring to be a neurosurgeon because of the experience that she had.
All of you probably would never have guessed that about 2.5 years ago, an auto accident really changed my life completely. I was barely breathing when they found me. Somebody had called 911, thank goodness, and they responded within just a minute of my accident. They got me out of the car, they took me down to Bayfront Medical Center. The injuries that I sustained from my accident, I actually had upper body trauma. I almost broke both of my arms. I had cracked ribs. I broke 3 thoracic vertebrae in my upper back. I had a compression fracture of my lumbar 3, which is in your lower back. And a compression fracture is actually when you separate your vertebrae into 2 separate pieces. And they really thought that they were going to have to do surgery. And I also, from the breakages in my back, I had paralysis in my right leg. My pelvis had broken in 3 places from where my console had folded over me. For the longest time, we actually didn't know that I had sustained a TBI. I didn't have any hemorrhaging of the brain or anything. I couldn't do simple math, and I was on the top of my algebra class. I couldn't understand what people would tell me. I was just kind of there. And they didn't know at first if it was just due to the pain medicine, why I was so out of it or not, or if it was really, or if there was something else going on. And actually my boyfriend, he told me later on after I got better that he noticed that when I wasn't able to tell him what the microwave was called, he said he knew something was wrong. I was a senior in high school, and I couldn't tell you that the microwave was called a microwave. Amy actually told my parents that I would be a really good candidate for this program called Interactive Metronome. And so we started the program. Actually, when everything happened with school, I wasn't able to read what my class was doing, or I actually had to stop my senior year because I couldn't participate because the testing showed that I had a reading level of a first grader. I couldn't even add 7 plus 2. I couldn't even tell you that that was 9. And further on with the therapy that I started in April, by August of 2005, I was actually ready to go off to college. Since then, I've been going up to college in Tallahassee, and I got a 4.0 for the first time in my life. Because of this whole experience, I started reading about neuroscience, and I fell in love with it. I understood it from, a point of view of someone who's learning about it, but I also understood it from the point of view of someone who has experienced it. And I've decided from then on that I'm actually going to become a neurosurgeon. I can tell you guys, this program, it's not just some program. It's the program that changed my life. It made me into an adult. It made me better than what I was before my accident.
We're going to do one last patient testimonial. This is another little boy that I had the privilege of being a provider for on a virtual level. I've never met Jalen or his mom, Roxana. They live in Seattle. I live in Colorado. But we sent the interactive metronome to them, and they completed the entire program within 6 weeks period of time. They did go on vacation for one of those weeks. I would just like you to listen to the results that Jalen has had since completing the interactive metronome.
For elementary age kids, and also my son is gifted with ADD, so I started looking online and looking to see if what IM was all about. He had a lot of just difficulty focusing. He was on Adderall, and really sweet child, but just really spacey. A lot of times I had to call him like 4 or 5 times to even get his attention. Had difficulty organizing at school and at home. A lot of difficulty following even like 1 or 2 step directions. Like if I had him go upstairs to brush his teeth and get dressed, he would probably go upstairs, but the rest of it I'd have to follow up quite a few times in order to get him to follow the routine. Also had difficulty with problem solving, where just everyday little things like figuring out how to do even like pouring cereal, or doing really more simple chores for his age. He had to really be taught directly how to do it, and I think it was more of organizational type of issues. And and he avoided doing a lot of things because of the just getting frustrated. We started seeing results even starting after like the 3rd week, but now that we've finished the 20th session, which is the 5th week, we've seen really, really dramatic, life-changing effects from it. Before, when he'd get frustrated with something, he would just kind of, start crying or just get real frustrated. But now he's able to have that more clear thinking, and he'll articulate and express himself, and we understand and we can talk about it. A lot of improvement in his focus, organizational skills. Now when I ask him to get ready for going somewhere, he can do up to 3 items, 3 different tasks, and follow through with them. So his soccer skills have even improved, just really a lot more on with his playing. In fact, he's never scored a goal before during a game, and at the last tournament he scored 3 goals in 2 games. I could see everybody improving from doing some IM, so I'd like to try it for myself.
Again, that was Jalen, and one thing I want to let all of you know, in my experience of doing interactive metronome, as you heard Roxana talk about her son, he improved at 3 weeks, but after 5 weeks there was much improvement, and we just touched base by phone last week, and that would be a good 8 weeks after training, and he has actually continued to improve. That's the neuroplasticity that I was talking about a few slides back. It's typical for a client to continue to make gains after they're done doing IM sessions. So if they were to complete 18 to 20 sessions of interactive metronome, I would fully expect improvement 3 to 6 months later to continue. So this is not the type of treatment that we typically will see regression in. I have to say typically because there's always that exception to the rule. So here's the big question. Can I benefit from interactive metronome home? Well, let's just go through this. Interactive metronome home is not for one diagnosis. It is for multiple diagnoses. We've talked a lot about ADHD, autism, Asperger's, brain trauma, or TBI, but it can also be useful for brain health and keeping your brain on a plasticity level, so keeping your brain working. Motor control, if you want to improve motor control for sports activities or for if you dance or do something, play golf, there are results from that you can benefit from. There has been new results that show that people with sports concussions from years back suffer in the future, and so we have to be careful that we're treating the brain and we're repairing the brain in a way that is healthy for it overall. Post-stroke treatment, this is a very effective treatment for that. Parkinson's, Alzheimer's, and again, the elite athlete. We do have a group of elite athletes that have sought out the IM home and the interactive metronome. What symptoms can IM home help? Well, any of these that's listed. Learning disabilities, attention problems, motor coordination, speech and language delays. We talked a little bit about sensory processing, visual and auditory processing, sequencing, following multi-step directions. If you or your child has poor organizational skills or poor social skills. These are all areas that can be helped by the interactive metronome. If you were to invest in an interactive metronome home, this is what you would receive. You would get the box, that's that white box in the middle, and that is basically the little box that gives you your tone that you need to clap to, that measures how close to the tone you are. All of that is explained once you get the interactive metronome home. You get unlimited hours, meaning that once you purchase the IM home, you do not have to go back and buy more hours or more upgrades. There's no catch with this. You get a button trigger or a hand trigger that is wireless, which is really great, and also a wireless tap mat, or what we call the foot trigger, and this is touch sensitive. That's the mat that you see, the black mat that's down there in front of the white box and the headphones. The headphones are wired, just for simplicity. You get a USB cord for your computer, software, and a 1-year manufacturer warranty. Your I Am Home plan is personalized and overseen by one of the virtual specialists who have on average over 20 years experience working with children and adults. Your specialist will tailor the program that you will complete to meet your or your child's specific needs. He or she will monitor your progress and make modifications to maximize your progress without you having to travel for training. Therefore, this is a home program, but it's also overseen by a therapist or a specialist very familiar with your history and with who you are, so that there is a virtual connection there. Your specialist actually receives your training reports each and every time you train. So you can't get away with not training and then telling your therapist that you did, because they'll know it's all sent to them virtually. It's really, really great. There are 5 weeks that we've set up for the I Am Home training plan. And after 5 weeks, you might decide to discontinue the services of your specialist or continue using the specialist under a different plan of care. We've listed a little bit about what you can expect to do each week. Now, this is fluid. That means that this will change depending on who you are and how your training goes. So if you're having a lot of difficulty with the training, we will slow it down and we will focus on different areas. But if you're breezing right through it and you need harder, more difficult tasks, we will also do that as well. You'll notice that during each week there is a follow-up email at the end of the week and a call that you get with your specialist. That's an evaluation and motivation call. So that's for you to touch base with your specialist and just say, hey, am I doing this right? What do my scores look like? How can I do this better? That's really an important piece to this puzzle, because you're not just out there training virtually without a connection. Your I Am Home specialist gets to know you. You get to touch base with them on a weekly call that is pre-scheduled. So you have an appointment every week, and it's also prepaid. So there's nothing that you have to worry about once you've paid for the program in terms of cost. So from here, it's easy. You get the package in the mail with the I Am Home equipment. You install and set up the equipment, and then your specialist gives you a username and password where a personalized plan will be waiting for you to start training after you touch base with your specialist. Interactive Metronome is open daily during the week, Monday through Friday, from 9 a.m. to 6:30 p.m. That is Eastern Standard Time.